Jim, thank you very much. Great job, as usual, bringing all kinds of stuff together. And I don't know about others, but I already had questions and suggestions and ready to go in there. So I do appreciate your continued leadership in this extraordinarily important area. When Jim was mentioning a little bit of my background, you know, I was given a presentation not too long ago up in Chicago on equity and many of these issues and the equity impact on them and so on. And I was introduced, and someone said the same type of things, that they actually put years to that. And they said that I had taught at the University of Maryland for 27 years and that I had been an elected official for 31 years and that I was now in my 15th year heading a national nonprofit. And so I gave what I thought with modesty was a pretty good speech and presentation. We had questions. First one, enthusiastic young person at the front raises her hand and she looks at me and she says, "How old are you anyway?" And so to put this in context, let me assure you that in Maryland, like in many states, you can be a local official and a college professor at the same time, and I'm not really 107 years old. But I will tell you this as well, listening to Jim's discussion of the activity level and health and all this sort of stuff, personal experience, just at the end of August, we decided to take a family vacation in London. I had last year a spinal operation, and my back and nerves in the leg in particular still give me some challenges. And so with our 15-year-old daughter, we trip off to London. We must have walked in that beautiful, wonderful, walkable city, and with all of the parks and the connections and everything, we must have walked 100 miles. I will tell you, by the third day, I had absolutely no pain for my back. The nerve was just absolutely gone. And I'm thinking to myself, why am I going to a physical therapist? Why don't I just walk in London all the time? What we are talking about here is extremely important. And that's why, let me ask our panel if they would come up and settle in here while I just say a few words, please. And I'm going to introduce you one at a time as we get ready, but if you would all come on up. Now, as Jim mentioned, the bios for our panelists are in the program, and I would urge you to go ahead and look at our extraordinary qualified contributors here. And I will not be going through the details there. I'm going to the assumption most of you can read, and so we'll leave it that way. This session is going to provide an overview, as Jim mentioned, about the relationship between the built environment, obesity, and health. And the important thing, I think, is for us to think of this in very broad terms. We know in many ways the relationship between obesity and health and many of the major impacts on the environment on our life. But the unfortunate result is that people are still getting sick, limiting their quality of life, and dying because of decisions that continue to be made about the built environment. It simply does not make any sense. And if you saw those diagrams or pictures of subdivisions that Jim put up, and we use the same thing in Smart Growth America all the time, because you can, when I work with foreign delegations come in and they go around the country, and I say, every airport that you fly into, look down and you're going to see exactly that type of development. And it does not make any sense, really, for us to need to get into a 2,000-pound machine that we call an automobile, drive 2 miles in order to get 1 quart of milk. And yet that is not only the way many people live, that is what we continue to build in significant parts of the country. The result is that we have broad impacts from the built environment on all different aspects of our life. And we have it because there's a lack of walkable, connected communities. We have, as a result of that, an extraordinary increase in respiratory illness resulting from the air pollution. We also have it because of our design in terms of impact on pedestrians. We, Smart Growth America, just released a report, Dangerous by Design, where we looked at the impact on pedestrians. I mean, Orlando was ranked, great tourist attraction and everything, the #1 death trap for pedestrians. And if you've ever been down to some of these streets and tried to cross them on foot, you understand what we're talking about. The recent report also shows the extraordinary impact on a growing portion of our population, and that is the elderly, the active elderly who wish to stay in the community, but may slow down just a little bit. And when you have, as you do, a few blocks from here at 16th and K, 6 lanes, counting the 2 service lanes, to cross on foot, 2 blocks from the White House, and the total signal time for pedestrians is 27 seconds. 27 seconds. And that was, by the way, after I complained because it was only 21. And they sent me this very nice letter that said they've increased the pedestrian time on this. The report shows, among other things, the great impact on the seniors, and particularly seniors over 80. The death rate there of pedestrian injury is extraordinary. I would also mention, and we were hit right in the face with this all last week, but we still sometimes don't make the connection. As Jim mentioned, our heart and our sympathy and hopefully our support goes out for the people in Houston and in Florida and the Caribbean over these storms. But what we also must remember is that the storms were worse, even in Houston with the extraordinary amount of water. They were worse because of what's going on and the physical design. What we have is a rapid increase, and several news stations comment on this, the rapid increase, almost a 4th increase in impervious surfaces in the last 25 years in Houston. And so what you see is flooding going on there other times that has nothing to do with a hurricane or anything of that type. We are paving over the green spaces. We are eliminating the ability of Earth to absorb and the water, and somehow or other thinking all we have to do is build bigger stormwater management pipes and everything will be fine. The truth of the matter is we do have climate change, even though I know it's now officially deleted from many governmental records, but we do have climate change, and it is in large part influenced by human activity. And so it's going to get worse, and what we're going to find is these tragedies that we see now will continue. And the question is, are we going to continue to pave everything? Are we going to continue to eliminate the natural sponge areas of our environment? At Smart Growth America, we focus on all of these issues, and as well as other things to make this work, such as downtown revitalization and density and design and things of this type. But we mostly try to highlight the links between walkability, sense of place, and the health of the citizens. We're looking forward to a very interesting conversation here today on these issues, and as important, I think, is what will come out of this in terms of future deliberations and hopefully impact on policy. One of the things that I believe is extraordinarily important, and I know that the basis of this be laid by our panelists, is how do we get the public to understand what is at stake here, and how do we get public to understand the decision makers? This is not just about economic activity. It's also about the condition of the health for our community as well. Our first speaker is Rodrigo Reis, who we're particularly pleased that they here with us. We're very excited to hear from his perspective since he's been involved in so many international projects that have focused on community design and promoting physical activity and health. And you have the details of that wonderful experience in the program. So at this time I'd ask Rodrigo if he would join us.
Hello? Yeah. Hello, everybody. Thank you so much, Governor. Thank you, Jim, and the roundtable members for inviting me and for having me here today. It's a wonderful opportunity to meet longtime friends and colleagues and to make new friends as well. And I really appreciate the Governor's words on the human tragedies that we are seeing now in Houston and in Florida. They are a strong reminder that lack of urban planning, proper urban planning, will make lives much worse with any tragedy that will be happening. But also, it's a strong reminder of how built environments are interconnected with human lives. And in built environments, when they are properly designed or when they are disrupted, they will affect largely people that can't afford to thrive in life without proper resources. So I think we are seeing human tragedies that we are seeing now